Hello, I am Dr. Nikhil, consultant physician, Srikarahospitals, Vijayawada. Today we are going to discuss about metabolic syndrome. So when we say syndrome, it is not a single disease. Syndrome is a component or a cluster of disorders. So four of a cluster of disorders combined together, we call it as a syndrome. So coming to metabolic syndrome, why is it important and why we need to discuss about this? Metabolic syndrome is in a rising prevalence nowadays. More than 33% of the Asian population are having this syndrome. So people with this syndrome are at higher risk for heart diseases, brain strokes and diabetes mellitus. So we need to know about metabolic syndrome and we need to prevent it at an early stage. So coming to the components of the metabolic syndrome, there are four main components of this metabolic syndrome. They are: 1. Hypertension or blood pressure more than 130 by 85 mm of Hg. 2. Diabetes, so fasting blood sugar levels more than 100 mg per deciliter. And 3. Cholesterol levels. The two main components here are HDL cholesterol and triglycerides. Triglyceride level above 150 and HDL cholesterol levels below 40. And the fourth main component is central obesity or truncal obesity. This is the fat or fat deposition around the waist, and we also call it as apple shape or apple obesity. So the main component here, how to diagnose, the main thing is how to diagnose this metabolic syndrome. The sad part is there is no specific symptom to diagnose metabolic syndrome. So we have to diagnose it based on the investigations. And one thing, how to self-diagnose metabolic syndrome. So we have to diagnose it based on the components. So as we discussed the four main components of metabolic syndrome, all the components like blood pressure, diabetes and cholesterol, they may not have any symptoms at an early stage, and it can be very late by the time the person has symptoms. So it is very difficult to diagnose it at an early stage only based on the symptoms. And coming to the fourth component, the central obesity or truncal obesity. So this the patient can easily measure at their home. If they have a measuring tape, they have to measure the waist circumference and the hip circumference. So if the waist circumference is more than the hip circumference, or if the waist circumference is more than 35 inches in women or 40 inches in men, then it is called as central obesity. So how to diagnose the other components? So what we tell is it is better to diagnose it at an early stage. So have an early health checkups. Previously, we used to have regular or annual health checkups starting with the age of 40. But in the present scenario or prevailing conditions, patients are being at a risk for this syndrome even at a very early stage starting at 30 years. So patients should have early annual checkups starting as early as 30 to 35 years in high risk patients, and in less risk or lower risk patients, they can wait up to 40. So who are these high risk patients? The high risk patients are the patients, as we discussed, who have the central obesity and who have any one of the components, like if they have either diabetes or hypertension or increased cholesterol level. Even if they have any one of these components, they are at a higher risk for risk factors of this metabolic syndrome. So coming to high risk patients, who are at high risk? Patients having any of these components like diabetes or hypertension or cholesterol are at higher risk. And also patients having this family history of diabetes or cholesterol or hypertension, or any of their family members having these adverse events like cardiac events or brain stroke or frank diabetes. These persons, they are at higher risk and they should start early annual checkups as early as 30 to 35 years. And coming to the treatment. So there is no specific treatment per se for the whole of metabolic syndrome, but each component can be dealt with. So based on the reports or based on the lab readings, your doctor will prescribe you the medications which you have to take. And the main component and the main thing is lifestyle modification. With this lifestyle modification, all the components of the metabolic syndrome can be kept under control. So coming to lifestyle modification, the first thing is food. So having the right food is the main key thing, but not just having the right food. You should have right food in the right quantity and at the right time. Having any right food just in large quantities or at any other time doesn't help. So all the three things, like having the right food in right quantity and at the right time, helps the patient. So it is better to have dinner by 6:37 or at the max before 8. And the second thing is physical activity. A daily moderate physical activity of 30 to 45 minutes at least 5 days per week is very important. And the third thing is having good sleep. A proper sleep of 6 to 8 hours is very important to the person. So don't get panic and don't get the weight loss. Weight loss is also one of the main thing. By following all these lifestyle modifications, there will be weight loss. But the main thing is persistence and sustainability. Don't get depressed if your weight loss journey is not according to what you have planned. Your cardiovascular health is much more important. So by practicing 30 minutes of physical activity daily, there will be a lot of change, a lot of improvement in your cardiovascular activity, and eventually weight loss will definitely happen. Thank you.